What is Duchenne muscular dystrophy?
Duchenne muscular dystrophy is a disease that affects the muscles due to lack of protein called dystrophy. They are well at birth, and by the time they get to about 2 or 2.5 years of age, they have difficulty in getting up from the floor. And by the time they're about 4 or 5 years of age, they have history of frequent falls and difficulty in climbing stairs. Around 10 to 14 years of age, they have difficulty in walking and they become wheelchair bound. After that, they remain on the wheelchair throughout their life. These children you find are a little delayed in their walking also, and when they walk also they're a little unsteady and tend to walk on their toes. But these are very subtle signs, and many times parents don't actually realize this. And then they realize that when they sit on the floor and try to get up, they have to push up on their knees and to get up, or they're not able to get up easily. This is when they generally come to a doctor, and this happens around 2.5 years of age.
What are some of the other types of muscular dystrophy?
There are lots of different types like Duchenne, limb-girdle muscular dystrophy, etc. But Duchenne is a muscular dystrophy that is seen in the world. I mean, they say it's about 1 in 3,500 people, but that is international statistics. I think our statistics is much more, and we should know about it soon because we did start a national registry on Duchenne muscular dystrophy a few years ago, along with the Indian Council for Medical Research, or ICMR. And that is ongoing at the moment. And we should have more clear-cut data from our own country soon. The prevalence could be much higher. And we do have a few families where even 2 or 3 children have been affected with the same disease. So supposing there's a mother who has a child with DMD, they don't realize that the chances of her sister bearing a child with DMD is high. So genetic counseling and carrier testing is not routinely done, and families do not go for the same, and they end up having another child with DMD in the same family. Other reason may be that there is history of consanguinity or marrying within relatives. That is a little higher in our country as compared to the West. Generally, it is just a lack of awareness amongst the families. And it's not in the domain of general public knowledge. And therefore, they don't necessarily go to a doctor until the problem becomes more. And by then, they've already had a second child, or their relative has had a child, etc.
How is Duchenne muscular dystrophy diagnosed?
Yeah, actually, diagnosis is not an issue now because of the availability of a test called MLPA, or multiplex ligation probe amplification technique, which is a genetic test, and it is much more available now, particularly over the last decade as compared to what was there in the past. But in the past, there was only a muscle biopsy which we could do, and that was available in very few centers in India. Now, with the genetic testing being available, it's very easy to make a diagnosis. But still, the biggest issue is that it's very expensive, particularly in the private sector. And in the government sector, it's not freely available in every government hospital. So diagnosis does get delayed.
Signs and symptoms of Duchenne muscular dystrophy.
So there is weakness, particularly in the muscles around the hips, and which is why they have difficulty in getting up from the floor. And then the weakness progresses to the shoulder girdle muscles, and therefore they have initially difficulty in getting up from the floor, and by the time they get to about 10 to 15 years of age, they have difficulty in walking, because of which they become wheelchair bound. And then they have difficulty in lifting their hands and eating as well. Of course, there are other parts of the body that get involved over a period of time. These children have involvement of the heart with poor pumping of the left ventricle in the heart. They can have issues with their breathing. They can have lack of proper mineral density in the bones, and which can cause easy fractures. So they need a multiple number of specialists to take care of them. And that is why in any center which deals with a child with Duchenne muscular dystrophy, they need a multidisciplinary team who can deal with these different aspects for the same child.
The advantages of diagnosing Duchenne muscular dystrophy early.
The advantages of early diagnosis, primarily, as I see it, is to deal with the child, identify the process, confirm the diagnosis, and to ensure that the parents get carrier testing done so that they don't have another child in the same family with the same disease. As the child is concerned, we can start early physiotherapy, which should be gentle and gentle breathing exercises. So rehabilitation can be started early. There is also a issue about consideration of steroids, which is very important aspect because definitely steroids reduce inflammation of the muscles and prolong the period that the child can remain walking. We have been part of the international group who have done studies on this, and we proved that early initiation of a type of steroid in children on a daily basis does help in preventing loss of ambulation in these children. And also the rehabilitation strategies like mild stretching exercises and breathing exercises help these children quite a bit. The biggest issue, because when the child comes to a doctor, they appear completely normal and they're well till about 2 to 3 years of age. And when you diagnose Duchenne muscular dystrophy, it comes as a complete surprise to the families because the child has been well until then, apart from having a little bit of difficulty in getting up from the floor or falling frequently or walking on their toes. So it is a shock for the families.
What are the next steps after diagnosis of Duchenne muscular dystrophy?
Important that they start gentle physiotherapy. And as I mentioned clearly, gentle primarily because many times the physiotherapists themselves need some guidance or suggestions from the physicians about how to go about with physiotherapy in these children. Excess strain on the muscles result in further breakdown of the muscles. And as the muscles are already dystrophic or breaking down, and you go and push the muscles into severe or heavy physiotherapy, you could cause further breakdown of the muscles and earlier loss of ambulation or becoming wheelchair bound. As soon as the diagnosis is made, they need to get evaluation of the heart just to look at the baseline status, an ECG, and a cleanly done. We do lung function testing to know the lungs are okay. That is if the child is able to cooperate, because at a young age, sometimes these children cannot cooperate with that. We do some blood tests, including calcium, vitamin D, etc., because some of them require supplementation. And then we discuss with the family about starting steroids, which is usually we start around 4, 5, 6 years of age. We wait until then, although in countries like the United States, they start at about 2 years of age. We delay it a little bit because we feel that the side effects of steroids seem to be a little more significant in our children as compared to what is seen in the West.
How does Duchenne muscular dystrophy progress?
As far as physical aspects are concerned, the child has difficulty in climbing stairs, history of easily falling down and hurting themselves. There are higher chances of falling down when they are playing with other children. So the teachers at school need to be alerted about it. Over a period of time, going to school becomes a problem because many of these children are unable to climb stairs or become wheelchair bound. And unfortunately, most schools in our country or most classrooms are on the first floor or second floor, and child has to climb. And most of the schools do not have a lift. And this makes it a very big problem for the child. So most children with Duchenne muscular dystrophy are forced to leave school or to do online classes from home. And this results in a lot of psychological issues, both for the child and the family.
A school for children with Duchenne muscular dystrophy.
In fact, this is one of the reasons why we started a school for children with Duchenne muscular dystrophy at Chennai. This was in 2009. Yeah, actually, so the story started that we've been involved in research and forming minimum standards of care for children with Duchenne muscular dystrophy over the last 25 years or so, along with the cooperative International Neuromuscular Research Group based in the USA, and also with the European network. We felt over a period of time that we were doing research, but we were not helping the families sufficiently. And because most of them were on wheelchairs and were putting on weight and appeared very depressed, including the parents. So in the year 2000, we started an NGO by name MDA India, along with the families of children with muscular dystrophy, in order to provide them whatever support is required for the children. We organized regular outings, fun days with children and their families to help improve their psychological well being. But we realized that what the families wanted and the children wanted was to help the children to attend school apart from all this. Our website, www.mdindia.net, details some of our activities over the last 24 years. And this is one of the reasons, with the families, we approached the Corporation of Chennai and the government of Tamil Nadu. And we are ever grateful for their support and help in starting a school for children with Duchenne muscular dystrophy at Chennai in the year 2009. And over the last 15 years, it has brought immense happiness to our families and the children. The school has classrooms on the ground floor and wheelchair accessible toilets, free access to all the classroom. We have 2 buses, which are specially equipped with hoists at the back, where 10 wheelchairs can actually be brought into the bus. They cover different parts of Chennai, and all the children who are on wheelchairs have been provided with motorized wheelchairs so that they can actually move around on their own. We have regular physiotherapy at school, and this is a regular school, mind you. This is not a special school, and they have regular curriculum at school. And this really has brought in immense happiness. So it's important that we deal with the medical aspects, but also consider the psychological aspects of a child who is otherwise well and has normal hearing, intelligence, vision, but is forced to sit at home because the schools or the restrooms in the schools are not accessible, or the classrooms are not accessible to these children. And that makes the whole family and the child feel extremely depressed. I only hope that similar schools come up all over the country, and the immense happiness and the satisfaction and the smile on the child's face gives us huge amount of happiness. This is not just a school. We have Christmas parties, we celebrate Pongal, birthday parties, etc. We also have regular outings to various resorts, beach, and all these bring about huge amount of happiness. So they're all looking forward to coming to school, even on Sundays. And they're very upset when there is holidays because they have to sit at home. Children have won state level swimming championships, participated and won medals in chess Olympiad. In fact, the recent one that happened in Chennai a few years ago, they won trophies in state level culture events. One of our children plays piano extremely well and got the second prize in zonal level waste and wealth management. Our teacher, our headmistress, got the Dr. Radhakrishnan Best Teacher Award from the state government. In fact, Virat Kohli was extremely surprised when a caricature of him, drawn by one of our children, was gifted to him during one of his visits to Chennai. Overall, therefore, it has brought a huge amount of satisfaction for us in MDA India and a huge amount of happiness for the families as well as the children. Unfortunately, at the moment, we have only about 20 to 24 children, primarily because our buses can't bring more children. There are, of course, families who are wanting to come, and this is the only school at the heart of Chennai at Thousand Lights. Therefore, I think it is time we need more such schools all over the state and the country, and we need more such initiatives. The wheelchairs have to come into the classroom, so the whole school has to be on the ground floor with barrier-free access, or have lifts so that the child can actually go in on the wheelchair to the classrooms easily. And they need a little bit of open space for the children to come around and move around comfortably. And so the classrooms have to be slightly bigger. And that's about it, actually. Otherwise, you don't need specific equipment. Of course, the buses are needed. The buses have to be specially made because you need hoists at the back so that the children can actually wheel themselves into the buses. Yes, we do have a template now. The happiness that the families have and the children have is enormous. I mean, I think the psychosocial aspects is very important, and this brings about, I mean, and the enthusiasm with which they want to do things, and the amount of creativity in these children is fantastic. When they do things and I mean, they're so happy. I mean, this really brings in. Many times we become emotional seeing how happy these children are. I mean, this goes up to high school. In fact, that's the issue now, because there was a meeting a couple of days ago. As many of the children who have completed their high school still want to remain in school or continue to come to our school, children over 18 years are not allowed to come into the school or in the school bus because this is a regular school. Therefore, now we are actually trying to start a vocational rehabilitation unit at the school so that we can help the children come for the vocational rehabilitation and not just sit at home, because they really want to come to school and they don't want to sit at home. Lot of things that they can do, because their hand function, the distal hand function, the finger functioning is okay. It's just that they can't lift their hands. So if you can ask them to take small bags or use a computer in a number of ways, they can do a lot of things. That is what we are exploring. We are working with another NGO and trying to see what are the suitable vocations for these children, and which will actually, which they can do and which will keep them happy.
What needs to be done for children affected with Duchenne muscular dystrophy?
The numbers are huge. I mean, we are primarily because we are into research as well, and we provide them medical support. I mean, remember, there is physiotherapy available at school. So all the children who come to school also get free physiotherapy exercises, and most of them, we organize camps for them to have evaluation on a periodic basis. And because a number of them get infections like chest infections, during this period, we could provide them with flu vaccinations in order to prevent respiratory infections. So we do a lot of other activities apart from just helping them with psychosocial support. They need a multidisciplinary support. So we do routine cardiac evaluations so that if they have poor left ventricular functioning, they may require some extra medications to help improve the pumping of the heart. For the lungs, they require devices like incentive spirometer to help improve the inflation in the lungs. And then later, when they have difficulty with bringing the phlegm out, they need devices like a cough assist device or a single valve ambu to help them to bring the phlegm out. Of course, as I told you, we give them flu vaccination to prevent respiratory infections, particularly in this season every year. As far as the bones are concerned, they need periodic follow-up with DEXA bone densitometry so that they prevent the thinning of the bones or osteopenia. Give them supplements with calcium and vitamin D supplementation, and periodically follow up with the endocrinologist. One thing that we also notice is that many of the children feel that they are much shorter than the other children. So there are ways and means of helping them grow fast, their growth as well. Of course, the neurologists and the physiotherapists become the anchor for dealing with these children. They also need the help of a good dietitian who can support them with appropriate nutrition, both in terms of nourishment, but also to prevent excess weight gain, because steroids do cause excess weight gain in some of these children. Once they become wheelchair bound, is they start developing what we call a scoliosis, or bending of the spine to one side or the other. That actually prevents the lung on that side from expanding properly. And this, as I said, causes recurrent respiratory infections. Already they have difficulty in bringing out their phlegm. So that might require intervention, not just from the physiotherapy or assistive devices, but from a good pulmonologist as to how to improve that with medications. The heart function I've already mentioned. Eating becomes a problem because sometimes these children can't lift their hands and eat. Nutrition or the dietitian has to help them with appropriate foods. And the biggest issue at home is that the parents are forced to take care of their heavy or children at home, and the routine tasks like taking down to the toilet and back multiple times a day, or use other modes while sitting on the wheelchair, is all easily said than done, but it becomes a big problem for the families as such. So there are various kinds of assistive devices like Hoyas, which are used in some of the other countries. Again, these are things that we need to manufacture in India and help the families with better equipment. Even the wheelchairs need good, what shall we say, good designs for better quality wheelchairs that can be manufactured. I mean, we do have the wherewithal, and what we need is to bring to the attention of the people who can help us with improving the quality of what we can do in our country once a child is wheelchair bound. Of course, keeping the child not bored is important at home, keeping them occupied, not just with TV or computer or cell phone, but they need some social skills, somebody to talk to, and important that is where I think our vocational rehabilitation center would actually help them, because they feel that they are actually contributing to the society rather than just sitting and chatting.
Has the survival age for children with Duchenne muscular dystrophy increased?
Yeah, I mean, most children survive till about, I mean, it used to be in the past till about 15, 16. Now they are living till about 24, 25, or even beyond that in some stages. But they do require some assistive devices like BiPAP machines, which can help their breathing, particularly at night when they are lying down and trying to sleep. And we have been fortunate with some of our donors who have come forward to donate these kind of equipments for our children. So yes, they need support, but they can live a more comfortable life as long as they live. And that is important to keep them happy and to keep the parents also feel that they are doing their best for their children.
The genetic consequences of Duchenne muscular dystrophy.
So counseling and carrier testing and prenatal testing becomes an important aspect of this sort of, a multidisciplinary team. But roughly around 25 to 50% of the children who are born to that same family can have another child with the same disease. And this can be diagnosed prenatally during pregnancy as early as 10 to 12 weeks of gestation in the unborn fetus, and seen if the child is affected or not. Certainly, then the parents have the choice of what to do next.
The presence of support groups for Duchenne muscular dystrophy.
I really do not know, but there are a lot of support groups, and and they do a lot of work.
What are some of the therapeutic options?
There are a lot of therapeutic options available, and the most in thing is talking about gene therapy. But one thing we need to remember is that gene therapy at the age of 16, 17, 18, when the muscles are completely fibrotic, is not going to be of much use. I think these kind of treatments have to be primarily given at an early stage, if at all there's going to be much benefit, because they are very, very expensive. And these are absolutely new treatments, and there are no long-term evidence to say that they are effective and safe. Talking about other more specific therapies that has been going on for a few years now, like the exon skipping therapies, these are useful for specific deletions like exon 51, 45, etc. They are also under study and need appraisal in the long term. There are certain drugs like attelurin, which are used for a specific genetic defect in the gene and is useful for a very small proportion of children with DMD, but they've really not shown as much benefit as it was anticipated initially. There are a number of steroid sparing agents that are under study at present. The advantage of looking at these agents is that they'll be useful for all children near DMD and not just few. But I think we are moving ahead and moving forward with a lot of studies now. Yes, I mean, the steroids are continued, but this actually depends on each and every child because the steroids appear to have beneficial effects on the heart, in the lung function, etc. So we do continue steroids even after they lose their ambulation. But again, the risks versus the benefits have to be weighed in each child. Yes, I think
Yeah.
our website www.mdindia.net is actually will give you some more information on what families require. Of course, it's probably not up to date, but it does give you most of the information that you require.
Standard information for children with Duchenne muscular dystrophy.
Yes, I mean, that is precisely what we were involved in with the UC Davis, trying to produce the minimum standards of care for children with Duchenne muscular dystrophy. This was part of what we published with the international group a few years ago. Actually modified that for our own country because some of the things are different in our country as opposed to the rest of the world in many areas. And we do have a format of what we should be doing in our country for our children with Duchenne muscular dystrophy at each of the different ages.